Hi everyone, and welcome to an overview of the mental health system in New Hampshire. My name's Beth Grosso. I'm a recent graduate of the MSW program at UNH, and I also work as the training coordinator for the Center for START Services, which is a program at UNH's Institute on Disability. Let's start by doing a broad level overview of the mental health landscape and organizations throughout the state that aim to provide an array of mental health services. First and foremost, we have community mental health centers, and we're going to go into more detail about what those are in just a minute. We also have psychiatric emergency and crisis services. Those are based in hospitals to provide assessment if a person is in an acute crisis. And it also consists of mobile crisis teams, which are based throughout the state and will respond directly to a person wherever it may be that they are in crisis. And they can respond in place of or collaboratively with the police or fire department. Peer support agencies. Those are also placed around the state, and they are led by individuals who experience mental illness, and their programs vary from region to region depending on the needs and preferences of their members. Some regions might offer transitional housing or crisis respite. Some might offer job skills training or trauma recovery groups. It really just depends. If you're interested in learning more, I would suggest that you go onto the New Hampshire NAMI website. Then we have private mental health practices. And those are practices that tend to bill private insurances for providing behavioral health care. Inpatient psychiatric facilities are where someone might go for a inpatient longer term stay, such as New Hampshire Hospital, which is the state's psychiatric hospital. The Cypress Center, Portsmouth Regional Hospital also has a behavioral health unit, and Hampstead Hospital. And then finally, we have general hospital emergency departments. Those are not high on the list because they're not intended to provide mental health treatment. However, it's where we see individuals go when they are experiencing an acute crisis, and it's often the doorway to an inpatient psychiatric facility. And in some cases, it's a doorway to a referral to an outpatient treatment center, like a community mental health center. Speaking of community mental health centers, there are 10 CMHCs, as we will call them, in New Hampshire. And these are private full-service clinics that offer a wide variety of therapeutic services. And we're going to go through what those services are in just a minute. First, I want to talk about eligibility criteria for community mental health centers. SPMI, that stands for Severe Persistent Mental Illness. Those disorders might include schizophrenia, might include borderline personality disorder, mood disorders, post-traumatic stress disorder, obsessive compulsive disorders, panic disorder, to name a few. In addition to experiencing a severe and persistent mental illness, the person must also have difficulties as a result of their mental illness in a number of different life domains, such as activities of daily living, like bathing, dressing, feeding, interpersonal functioning, like friendships, families, relationships, adapting to change, being flexible, being able to modify one's routine when life throws you a curveball, and concentration in task performance or pace, like completing common tasks, like dialing a phone or doing any kind of common activity in a reasonable amount of time. The difficulties can either be moderate in all 4 areas, or a person might have marked problems in 2 or more of the areas, or extreme problems in one area, and that would qualify someone to receive community mental health services. The final point that I want to make about community mental health centers is that they're largely reliant on billing from Medicaid. So what does a community mental health center offer? Well, first and foremost, they offer 24-hour emergency services. I had mentioned earlier that sometimes you'll have clinicians that are placed in emergency departments, and they will respond and assess individuals who come in with a behavioral health crisis. That's hosted by the Community Mental Health Center, and that clinician is connected to the Community Mental Health Center as part of their emergency services department. They also offer assessment and evaluation, and this helps to determine a person's eligibility. It also helps to inform the treatment plan if the person is determined to be eligible. They offer individual, family, and group therapy. They offer case management services, community-based rehabilitation services like supported employment, which is an evidence-based program that helps individuals find and keep jobs, as well as functional support services, which helps people to work on those adaptive skills that we talked about earlier in the community, in the settings where they live. Community mental health centers also offer psychiatric services, and this is sometimes referred to as med management. This is where a psychiatrist is going to provide a person and prescribe a person rather with psychiatric medications to help manage some of their symptoms. Community disaster mental health support is also a service offered by a community mental health center. All community mental health centers have specialized programs for older adults, for children, and for families. Community mental health centers also provide services and referrals for co-occurring mental health and substance use disorder treatment, as well as for short-term counseling and support that might not rise to the level of a severe and persistent mental illness. Now that we've talked about the New Hampshire mental health system, let's talk about some of the gaps. In a report published by the Human Services Research Institute, New Hampshire's mental health system was described as being drastically under-resourced. This limited capacity can lead to limited access to care and wait lists. The eligibility criteria means a lot of people that need help won't qualify. Cross-systems collaboration is also lacking. And cross-systems collaboration means that the mental health system might collaborate with the primary care doctors that are providing primary care, or perhaps criminal justice agencies, or child protection, or developmental services. There's no statewide mobile crisis and hospital diversion program. While there are some counties in New Hampshire that do have mobile crisis units, it's not statewide. Behavioral health care is not widely available in primary care settings. This goes back to the cross-systems collaboration, and it also speaks to the need for integrated care, which we'll talk about in a few minutes. There's challenges with workforce capacity. Do we have enough people who are trained in providing mental health support and treatment to staff all of our mental health agencies? There's issues around community engagement and community acceptance. And we'll talk a bit about the impact of stigma in just a minute. Special populations like co-occurring developmental disabilities, substance use disorders, older adults, and veterans. We need to build our expertise in these areas. Low reimbursement rates have also been cited as a primary challenge for the operating of community mental health centers. There's also the challenge of mental health coverage varying among private insurers, which makes it difficult for people who do not have Medicaid or Medicare to access mental health services. And finally, community services and housing supports, which are directly connected to the mental health of a population, are lacking. So what are some barriers to accessing mental health services? Well, first and foremost, stigma, and I had mentioned stigma. Many New Hampshire communities remain really ill-informed or indifferent about mental health, which can make it a really unwelcoming environment for people who experience mental illness. So obviously, community education is the best way to combat this problem by increasing public understanding and awareness and support for people with mental illness. Mental health stigma undermines a person's help-seeking behavior. It contributes to the homelessness and or underemployment of people with mental illness, and it also leads to biased and ineffective public policy. Another barrier to access is budget cuts and wait lists. It can be really demotivating to finally make the choice to look for help and then have to wait and wait and wait. Navigating a complex system. And this is especially true if you're a person who experiences one or more mental health needs, as well as those special populations that we talked about a slide ago, such as people with co-occurring developmental disabilities, substance use disorders, veterans, older adults, and such. Workforce shortages, cultural barriers. If the agency that you are being referred to does not speak your language or provide adequate translation services, it can be very challenging to engage in mental health treatment. And finally, financial. We've discussed challenges with regard to Medicaid billing. We've discussed the varying reimbursement rates and coverage policies in private insurances. And then there's the out-of-pocket expense. And oftentimes, those costs become too overwhelming and serve as a deterrent to people accessing appropriate mental health treatment. What are some of the consequences of these gaps and barriers? Well, I broke them down into individual and system level consequences. So first, individual level consequences are delayed treatment, and this results in unaddressed or exacerbated mental health needs. And it can also involve justice or criminal involvement, involving the police getting arrested and criminalizing mental health symptoms when what the person would actually benefit from is some mental health treatment. Systemically, you're going to see an increased use of tertiary level crisis care. That's where the emergency department comes in. I mentioned them as part of the New Hampshire mental health landscape because, like it or not, they are, but overusing them because there are gaps in our mental health system leads to crowding in our emergency departments, and it really leads to poor outcomes for individuals who are in need of quality mental health care that they are not going to receive in an emergency department. Another consequence of gaps and barriers can be inpatient psychiatric stays, which are ultimately more costly and do not provide the long-term outpatient care that most benefits people who experience mental illness. And finally, the final systemic consequence would be a strained and under-resourced system. And it can be very difficult to pull out from under a strained and under-resourced system. Now let's look at some examples of ways that innovative programs in New Hampshire have begun to bridge some of these gaps. First are what are called affiliate centers. I had mentioned the provision of short-term counseling services, and this is something that many community mental health centers have started to explore. These services are intended for people who might not meet eligibility requirements for a community mental health center, that being experiencing a severe and persistent mental illness that interferes with one or more of their activities of daily living. But it doesn't mean that they don't need mental health services. And because there's such a challenge in accessing mental health services in New Hampshire, community mental health centers have started to set up these counseling groups. So for example, the Greater Manchester Mental Health Center has established the North End Counseling Program. And this was taken right off of their website, and it describes the types of treatment that this counseling program offers. Community Partners, which is the Community Mental Health Center in Stratford County, has the Rochester Community Counseling Center. And this was actually formed through a partnership with Frisbee Memorial Hospital, which is the hospital in Rochester. And the counseling center is staffed by Community Partners clinicians. Receiving a referral to Rochester Community Counseling includes access to psychiatric assessment and medication recommendations that are then shared with the person's primary care provider. So a little demonstration of integrated care there as well. Another example of bridging some of the gaps in New Hampshire's mental health service system would be the Fast Forward program. And this helps families navigate across mental health, education, juvenile justice, and other systems to develop a coherent plan for success. This is currently being piloted and expanded in the Monadnock region and in school districts throughout the state. Another example is the Housing Bridge Subsidy Program. And these housing bridge programs provide safe, stable, and affordable housing for more than 800 people across the state who experience severe mental illness who are awaiting Section 8 housing vouchers, thus bridging the gap right? They don't have a Section 8 housing voucher yet, and so they're at risk of homelessness. So this housing bridge subsidy program helps them to stay on top of their rent while they wait for their Section 8 voucher. And finally, another model program, an evidence-based program, is the ACT teams, the Assertive Community Treatment. ACT teams offer intensive interdisciplinary support to help people with serious mental illness avoid inpatient placement where feasible and function more independently at home, at work, and in their community. And ACT teams are currently implemented at each community mental health center. So when I was doing research to put this presentation together, I looked at New Hampshire's 10-year mental health plan, which was just released earlier this winter. And I came across this image and I had to share it because I think as people who are reviewing applications for United Way, this is the type of vision statement that can really help to better define what qualities it is that you're looking for. So each of these different ovals represents sort of a different gap that is being filled and addressed within our mental health service system. So community education. So that is really integral to reducing community stigma around mental illness. Prevention and early intervention helps to identify at-risk groups and provide proactive support to prevent the occurrence of crisis, to prevent the use of those tertiary level interventions like emergency departments. Outpatient treatment. You're going to see mental health availability in primary care settings. You're going to see increased availability of assessment and diagnostics, consultation services, treatment, and also rehabilitation and recovery. Step up and step down options, which offer options for a person who is either attempting to leave and be discharged from a hospital stay or perhaps avoid a hospital stay. And then crisis and inpatient services. So providing support during crisis. And this can range from community-based in-home support like mobile crisis to longer-term residential stays in an inpatient setting. This also comes from the 10-year mental health plan, and it outlines values and principles that support New Hampshire's mental health vision. I'm not going to go into detail and read each one, but I would like to just highlight the values that are listed here in the left-hand column. Person-centered. A whole person focus. So not just one aspect of the person. Empowered people, families, and communities. Localized services. Services that are in the person's hometown, near them. The further away they are, the more challenging it can be. And that's a definite barrier to access. Pooled resources, infrastructure, and accountability. And finally, equity. And equity relates to eliminating disparities in some social determinants of health and ensuring equal access to everybody who is seeking support and services. So I mentioned that the preceding two slides were outlining some of the qualities that you might see in a strong proposal. And here's a bulleted list of things key factors that you might see in a strong proposal. First and foremost, you're going to want to look for a proposal that's seeking to fill in gaps and address some of the barriers to care we've discussed today. Qualities might include an emphasis on overall wellness, continuum of care models, much like the slide prior to this with the ovals sort of proceeding from least intensive to most intensive. Integrated care models. Models that integrate the treatment of substance use, healthcare, social services, and long-term support sectors. Wraparound services and multi-tiered systems of support. And that's a model that's used in schools. Creating pathways for common and complex conditions. And this will help ease some of the barriers faced when accessing a very complex system. A focus on prevention and early intervention. Step up and step down services that are aimed at decreasing overall emergency service use. Enhanced professional development. That means training people to provide quality mental health services and increasing the number of qualified professionals that we have in our workforce in New Hampshire. And finally, when in doubt, look to the values and principles reflected in New Hampshire's 10-year mental health plan. Person-centered, whole person focused, empowerment, localized services, pooled resources, accountability, and equity. The slide outlines a list of resources that were used in developing today's presentation. There are also very helpful resources for you to look into if you're interested in learning more. Thanks so much for listening, and best wishes.